I'm Jenny. I'm a carnivore educator here on YouTube, and one of the ways that I stay current with my education and the research that's being conducted in the low-carb space is by heading to low-carb conferences. Today, Gorn and I are heading over to Boca Raton, Florida to attend the Symposium for Metabolic Health. There's going to be lots of big names in the low-carb space here, including Dr. Boz, Dr. Ovadia, and Dr. Westman. Let's hit the road. Made it to our suite. We're staying in a Sonesta Select, pretty close to the conference. Let me give you a room tour. Nice king-sized bed, closet, TV, little baby desk, nice little fainting couch. There's even a little baby balcony. How cute. We've got our little coffee bar. Ooh, let's see if there's a fridge. Ooh, and it's a normal fridge too. We like that. So we can put some carnivore foods in there and a normal hotel bathroom. We must find carnivore treats. On the menu for this evening is a whole chicken, steak, salad, and we already ate the pork. And apparently 8 sauces.
Exactly 8.
Exactly 8 sauces. Oh, hello. Outfit for day 1. My book cover was just approved and I'm gonna be putting together an official, release for, well, not release, an official announcement that the pre-order has begun. What did you think of the first 3 speakers today?
Oh, I thought they were very good. Obviously very professional, good speakers. They bring a lot of clinical practice to what they're talking about. They clearly all understand very well the links between metabolic health and women's health issues. And
I really liked the talk on endometriosis by was Andrea Salacito, I think her name is. A leaky gut. What she talks about is like how perhaps the reason why it's happening in the first place is gravity. If you have a leaky gut, all that extra stuff is kind of leaking down into your pelvic area and kind of exacerbating the endometrial cells, and that's where the inflammation comes in, and that's what's causing all of the issues. The doctor from Egypt was talking about how it is good to get a mammogram just to see the density of your breast tissue, just to know if you have dense breast tissue or not.
to get a baseline, yeah.
To get a baseline. We always have cancer in our bodies at all time. Usually the way our cells work is they clean it up and get it out. It's just a cell mutation. If you come across, a 0 level cancer or a 1, they may overtreat it, and in overtreating it cause a lot of damage. So Zoe Harcum's like, I'm not getting mammograms. It's just not enough good evidence to show that it's helpful. Overall, first great half of the day, I think. Mama Tata on the phone, Mama Tata on the phone. Hello, Stinky. ButcherBox is a premium meat subscription service that's dedicated to delivering high-quality grass-fed, grass-finished beef, pastured beef, organic chicken, pork-raised, crate-free, and wild-caught seafood straight to your front door. ButcherBox prioritizes ethical sourcing and sustainability with the convenience of free shipping with every order. You can build a custom box and create the perfect mix of cuts for you with over 25 cuts to choose from, or you can let ButcherBox curate a box for you. Every box is a chance to try something new, along with a few tried and true classics. It seems like every week there's a new amazing deal on ButcherBox. So if you click on the link in the description, it will take you over to whatever their current deal is. I can't wait to be able to eat some meat again after I love carnivore bars, but I need some meat, and I've got a ton from my latest ButcherBox. So thanks again to ButcherBox for sponsoring today's video. Good morning, day 2. Ready to rock. Got some ketones for me? Let's hit these streets. Lunchtime. Day 2. Dr. Prada had a really great discussion about cost and incentives. Like, you have to understand where each of these companies and all these, insurance companies, big pharma, all that kind of stuff, where they're coming from. It doesn't necessarily make them evil. It's just their function, their incentive structure. Medicine in and of itself isn't bad, but making sure that you're using it correctly, like he was saying for the GLP-1s, as an adjunctive to lifestyle shifts. It's not the other way around.
Right.
You don't just take the drug and then the adjunct is the lifestyle. Type 2 diabetes, the fact that we're treating it like it's a chronic disease. It is if you treat it the way the American Diabetes Association is saying.
Take this shot or take this pill.
Take this insulin, even though it makes you fatter and it doesn't help the problem. Become more insulin resistant. It's like, no.
Well, it's actually making the hole deeper because it's making it worse. Your insulin responses, you're getting less sensitive because it's constantly pegged. But the fact is that, if you're not following it with coaching to teach people how you have to eat in order to correspond with that, learning that is critical. And when you stop the drug, that's all that's left. You've got to know how to eat in the first place. And
addressing all the underlying conditions that got you to where you are,
Treating it as
it's not a Band-Aid.
Magic pill is dangerous, really, because really, again, what you're mostly losing in that weight, which is what people are looking at, is your muscle tone and your bone mass, and that's real dangerous.
You don't want to lose that shit.
Real dangerous.
All right, Jim?
Let's do it.
Well, I'm really hungry, so we're going to get off this live stream. Thanks for watching. I will have another one for you next week. I don't know when yet, though. Okay. Bye. What a day. Another great day at the Symposium. It's always good, honestly. This is the 3rd time I've gone, and I learn something every single time. So day 3 of the Symposium for Metabolic Health. First half of the day, going well so far. I've learned a lot about GLP-1s this weekend.
It's not just a bunch of people using GLP-1s in an uneducated way to, just gonna lose weight.
It was off-label for obesity, but now that's a recommended use for it. But the real value comes in the reduction in inflammation and insulin resistance. That's where the real value comes in. And then after that was Dominic D'Agostino, who talked about ketones and the use, ketogenic therapeutic carbohydrate reduction in the use of cancer treatment. Very interesting talk. So just plowed 4 burger patties down the throat. Now we're gonna try to go get like a 20-minute, 15-minute workout in before we need to be back because Dr. Ovadia is speaking at 1:30.
Yay.
Yay, that'll be good. All right. Panel done. That was the last thing of the day, and now we are having a little dinner. So when we got back from the gym, the next speaker was Dr. Ovadia. Dr. Ovadia is a heart surgeon that does carnivore, excellent resource. Almost every doctor in the space is a conventionally trained doctor that had some kind of light switch moment, either a personal experience or like for Eric Westman, 2 of his patients did keto on their own and had remarkable improvements. So that's kind of what got him going down the path. So everyone has a different path to it, and his story, similar. So for the panel, we had Dr. Siwas, Dr. Ovadia, Dominic D'Agostino, Dr. Abdul Hadi from the first day. She was the cancer doctor. And then Dr. Salicido, who did the endometriosis talk. She ended up coming on like halfway through. So there was a lot of really good questions. There was a question about A1C and how some people on carnivore see rises in their A1C and what to do about it. Siwas doesn't think that the red blood cell turnover lifespan thing is a thing. Ovadia does. Apparently Sean Baker had to lower his protein intake because his A1C was kind of ticking up. Their whole solution, which I totally agree with, is just put a CGM on and just see what your actual average glucose levels are. And if they're low, like mine, but just make little tweaks, and then you can see that go down. Try berberine. Try lowering the amount of protein you're eating. Things like that. So that was an interesting question. Good conference. All right.
It's excellent.
That was so good. That's it.